So our project is about ketamine. Some historical overview of ketamine. It was first identified in 1956 as an anesthetic alongside PCP or phencyclidine, and then later down the road found as an NMDA receptor antagonist, then later again found as a form of intravenous anesthetics, and then later today to modern day is a treatment for certain anxiety disorders. However, it is still able to be used recreationally and has addiction possibilities. Some of that initial 1960s research first focused on PCP as a surgery anesthetic. However, due to the aversive side effects with phencyclidine, it was found to not be suitable. This is why they initially turned to ketamine, and they labeled it as a dissociative anesthetic due to the feelings of floating and weightlessness when taken. However, other aversive feelings were found, such as feeling of dying. So some of the effects of ketamine, they have psychological, physical effects. Since it is a hallucinogenic drug, hallucinations and dissociation are common, but along with the physical effects, it could be slowed breathing and that floating sensation, sometimes immobility. And with extreme use, it can have very negative effects such as brain damage, even psychosis and seizures. The pharmacodynamics of ketamine are similar to alcohol that we learned. It is non-competitive antagonist for NMDA receptors, and so it blocks the binding of glutamate. However, these PCP/ketamine binding sites are within the NMDA receptor channel, so that is how they are non-competitive. These compounds require the channel to be open for binding to occur, and they will then be trapped within the channel until the receptor is reactivated. And so a lot of people think that this antagonism is due to an increased presynaptic glutamate release. There is also some talk of a preferential blockade of receptors on the inhibitory GABAergic interneurons that we learned about, and this glutamate surge alongside the relationship with the GABAergic interneurons likely contributes to the behavioral and physical effects of PCP and ketamine. The primary route of administration for ketamine also is primarily IV administered with a 100% bioavailability, and this is also why it's really useful as an IV anesthetic.
So we decided to focus on ketamine as a treatment for severe depression rather than its recreational use. And there are many points that I'm going to hit on, such as its effects and its use for various psychiatric conditions. And lastly, and most importantly, its role in neuroplasticity. So for its clinical use, it is used for treatment-resistant depression in many different types of psychiatric disorders, and it can be used in conjunction with typical treatments. So with bipolar disorder, people would use it along with their typical mood stabilizers. It is fast-acting and has antidepressant-like effects, as discussed before. However, it is relatively short-lived, especially with IV and intranasal administration. This may last up to weeks, though, after multiple rounds of ketamine infusion. However, this recurrent use of ketamine does heighten the addiction potential exponentially. So ketamine is an extremely reinforcing drug in animals, which is paralleled by the drug's rewarding properties as an anesthetic. It activates areas of the midbrain and dopaminergic firing, which enhances dopamine release in the brain. This can then lead to tolerance in chronic users. So neuroplasticity is the idea that the brain adapts and changes over time in response to different stimulations and new information, such as development and sensory information. So depression is linked to a decline in that neuroplasticity, so a decline in neuronal connections. Ketamine has been shown to increase dendritic spine density in the medial frontal cortex within a day, which is extremely quick. Another study has indicated that ketamine also begins to reverse stress-induced dendritic spine loss. So in this figure, you can kind of see that after 24 hours, those new dendritic spines are created, which plays a role in that neuroplasticity and protecting against chronic depression. You can also see that the antidepressant effects are very fast. So overall, ketamine can be used as a great resource for treatment-resistant depression and severe cases of depression. However, with its addiction potential and its anesthetic effects, it is important for more research to take place in determining the efficacy of this drug.